All right, anemia after weight loss surgery. What is anemia? That's usually when people say my blood count is low. There are different types of anemia, but for the most part, it's actually low in iron. And you have to figure out, your doctor has to figure out like what's causing it, right? So there are a couple different things. One, you could be losing blood. So this would be true for women who have heavy menstrual cycles. Some women with heavy menstrual cycles are chronically anemic. Number two, you could not, it's possible that your bone marrow is not making enough red blood cells, in which case this is a blood issue, right? So your doctor needs to check you up to make sure your bone marrow is working efficiently. And then the last one is maybe it's an absorption issue, right? So your the chemicals that are needed to help your body make hemoglobin, including iron, thiamine, B12, etc., all your vitamin Bs, they need to get absorbed in your GI tract. So we see iron deficiency anemia often after gastric bypass, for example, where patients aren't able to absorb their vitamin B levels. So a lot of times they'll have to take, so you got to make sure you're taking your vitamin B supplements. The best way to take your B12 is sublingually, so that means put it underneath your tongue. Now sometimes bypass patients will have issues where their anemia is so severe that they actually require IV infusions. That means they go see a hematologist every month and sit down and get IV iron infused. Now, some situations are so bad that when doctors can't control your anemia after a gastric bypass, some bariatric surgeons will actually reverse your gastric bypass. And reversing a gastric bypass actually isn't that hard. It's pretty simple to do. Problem is that the main consideration is what do you want as a result? So do you want continued weight loss? So in which case some surgeons will do a gastric bypass, and then once they get you all hooked together, they'll do a sleeve. Now if they do that in one surgery, that surgery, while it's possible, has a very high risk of complications. Most surgeons will do it in two steps. That means they'll reverse the gastric bypass, put you back together, let you heal up, and come back in 3 to 6 months, and then do your sleeve. Now, at that point, it's up to you to make sure that you don't blow all your weight loss and just gain a bunch of weight. Okay, so that's super important. Now, anemia with a sleeve is much rarer. Much more rare? Rarer. But it does happen. But most likely it's not due to your sleeve. Most likely it's due to either chronic blood loss, like heavy menstrual cycles, or nutritional deficiencies like your B12, etc. Now, sometimes like maybe your surgeon took too much of your stomach, like too much of your antrum, so that you have a mild form of what's called pernicious anemia. You can check that out too. Usually though, it's pretty mild with a sleeve. Anemia is pretty mild with a sleeve, and so you can take iron supplementation. But I will tell you, it's pretty common in the modern world for women to have to take iron supplementation. A lot of that is due to the poor nutrition in our foods too. Cool. I hope that's been helpful. Anemia after bariatric surgery.
Hi, Dr. Vuong here. If you loved that video, I hope you will check out velocity2020.com. I want to meet you in person. This is my big annual conference in Vegas. It's amazing. It's not just about weight loss surgery, but it's about taking your life up to the next level. You're going to meet the best people, the best speakers, the best audience possible. You're going to really take your life up to the next level. 2020 is all about vision, clarity, and focus. We're going to show you how to find your vision, what you really want to do with your life, get crystal clear, clarity, and then find your laser focus to do what you need to do to have the amazing life that you deserve. Hope to see you there.